Hi, my name is Latoya Nash, and I will be going over prenatal care for mothers who are expecting. So, first, I would start off by performing hand hygiene just in case I have to touch or assess the patient. And then I would go into to the room, knock on the door, introduce myself, and then verify the patient's name, date of birth, and probably ask how many weeks they are. I will explain what I would be doing today, and that is just to educate the patient on how their prenatal visits well how their prenatal care would go until the day they deliver, and some things to look some warning signs to look out for. So first I would start off by informing the patient of how often they would come in and see their OBGYN. So from the time that they find out that they're pregnant from their first visit to about 28 weeks, they will be coming once a month or every 4 weeks. And then from 28 to about 30 weeks, they will come bi-weekly. And then from the 36 mark to delivery, they will come once a week. And then with those, in those times coming in, there will be some genetic testing, some STI testing, to make sure that the mother doesn't have any STDs that will transport to the baby, checking anemia levels. We will also do some gestational diabetes testing, but that's around like the 20th week mark. Um, Also, I would talk to the patient about a well balanced diet and foods that they should consume for them to remain healthy or be healthy, and things that they should consume for exceptional development of the baby. So that would be food, protein rich, omega 3 rich foods, um, fruits and vegetables. Making sure that they take their prenatal vitamins with folic acid, because that will promote prevent neural defects, uh, and it's essential to development. I would then also uh, tell the patient to take prenatal vitamins that have like calcium, iron, and things of that nature, because all those nutrients will help have a healthy baby. I would, if the big patient was concerned about exercising, I would inform them that low impact exercising is okay. And that would include like yoga, swimming, cycling, walking, and things like that. I would encourage them to avoid high impact, um, exercises. And those are the ones that would either make her at risk for falling or severe injury, as if she fell or if she injured herself or dropped a weight on herself, it could injure herself and the baby. I would tell her, I would talk to her about optimal weight gain. So for patients who are normal weight, which is between, or underweight, which is anything BMI under 18, I would tell them that they would probably want to gain between 28 to 40 pounds. And then for those who are normal weight, which is between 18 to 24, I would tell them that they would probably gain about 25 to 35 pounds. And then, I said normal weight. Overweight, which is like 25 to 29.9, I would tell them that they would the optimal weight gain would be between 15 to 29 pounds. And then anything like above 30 BMI is considered obese, and they will probably need to gain an optimal weight gain of 11 to 20 pounds, for optimal development of the baby, and just weight gain for themselves. Typically, when women are pregnant, they complain about certain things like, well, the most common would be like nausea and vomiting, back pain as the fetus grows, and fatigue, like being tired. And the fatigue comes with like, the growing baby and hormonal changes, and then back pain depends on how where the baby is positioned or how fast they're growing will cause weight gain, will cause probably back pain, and then nausea, vomiting, with just all the changes that are going through with their body. The upper and lowering of hormones can cause nausea and vomiting. So for general relief for that, for nausea and vomiting, I would tell the patient to, try to stay as hydrated as possible. Encourage them to eat small, frequent meals. Um, um, there wouldn't be anything to prescribe them at that moment because of, risk to other birth defects. So then, just small, frequent meals, resting, staying hydrated, and things of that nature. And then for like back pain, I would encourage the patient to get like supportive shoes, do some relaxation techniques, maybe have the partner do like light massages in the area that is aching, and then hot or cold compress. And then fatigue, I would just encourage the patient to rest as often as possible, to just give herself breaks and just, just not, try to keep her normalcy of her life before when she wasn't pregnant, and just, rest as often as possible. I would also tell the patient to look out for severe, oh no. I will also encourage the patient to look out for warning signs, which would be like severe abdominal pain, vaginal bleeding, and decrease or absent fetal movements. As severe abdominal pain could be probably preeclampsia, or depending on how early the patient is in her weeks of pregnancy, ectopic pregnancy. Vaginal bleeding could be miscarriage or ectopic. And then low fetal movement or fetal distress. Low fetal movement or no fetal movement at all could be other complications, or it could possibly mean that the baby is in or is in distress. And with any of those, I would encourage the patient to immediately call her OBGYN or labor and delivery for an assessment. And so I would thank the patient, ask them if they had any questions, and then I would provide the patient with brochures or pamphlets and resources if they had any follow-up questions. Thank you.